If you're 60 or 70 years old and you have problems with the arteries of your legs and you can barely even walk, or maybe you're in your 40s or 50s and you're suffering from frequent headaches and pain in the chest and you can't do any exercise, or maybe you're only 30 years old and you don't want this to happen to you, this is called atherosclerosis, and we know how to treat it. A 67-year-old man couldn't even walk 7 minutes due to problems in the arteries of his legs. After 2 courses of treatment for atherosclerosis, it began to go away calmly within an hour. Another man, an entrepreneur, 45 years old, his heart vessels were 70% clogged and his neck vessels were 50% clogged. He was tormented by frequent headaches and he wasn't able to do any sports or exercise. After 3 courses of treatment, he began to run 10 kilometers a day, and his headaches completely disappeared. In this video, I'll explain to you about atherosclerosis and the effective methods of treatments in our clinic Lymphatec. My name is Nadezhda Garyaeva, and I'm the head of the Perm School of Lymphologists and the founder of the Lymphatec Clinic. For more than 30 years, we've been developing scientific technologies called lymphatic access technologies and introducing them into practical healthcare in the treatment of many diseases. These are new principles of pharmacodynamics. Information about this is heard only in specialized audiences from scientific departments. This is a video about what medical students are not taught in universities. And finally, this video is about how atherosclerosis can be treated with our technologies, including atherosclerotic plaques. So, I'll tell you about the danger of atherosclerosis, what you need to do to examine yourself for atherosclerosis, what atherosclerosis is, and what doctors usually do not tell their patients in clinics and hospitals. And finally, what to do to prevent the development of stroke and heart attack as the most dangerous complications with atherosclerosis. I'll introduce you to our Lymphatec method. At the end of the video, you'll find out why no one in the world treats atherosclerosis the way we treat it at our clinic, Lymphatec. It's already 2024, but people still continue to hope that heart attacks and strokes, the number 1 and number 2 causes of death in the world, can be avoided with the help of magic pills. In addition, everyone says that atherosclerosis cannot be treated, but this is not true. Let's look at the facts. A heart attack claims 16% of people's lives in the world. Strokes claim 11%. The main reason for both is atherosclerosis. When atherosclerotic plaques block blood access to the brain, this is called a stroke. If the same happens to the heart, this is called a heart attack. According to WHO, the World Health Organization, in Russia in 2019, 442,000 people died from heart attacks and 260,000 died from strokes. That's more than 700,000 lives. There are no statistics yet for 2022. Why? Because the recent pandemic does not yet allow us to put the statistics in order. But the same infection that's now known to the whole world has aggravated conditions in the blood vessels, so the statistics will be even worse. A 47-year-old patient recently came to our clinic. He suffered from a coronavirus infection, which really worsened his health. During the examination, it was found that one of the main lines, the anterior interventricular branch of the left coronary artery, was stenotic by 75%. What does this mean? Coronary artery bypass surgery, when cardiac surgeons bypassing the stenotic area creates a blood supply to the heart using the graft system. Let's talk now about how to prevent this situation, what you need to do to examine yourself for atherosclerosis. Regardless of age, there's a small set of completely non-invasive technologies that are available to everyone. For example, what should you do when you're approaching your 40s or older? Daily monitoring of ECG and blood pressure is mandatory. Blood vessels also need to be examined. Brachiocephalic vessels, vessels of the neck, and arteries of the legs. This is also available to everyone because such first symptoms as noise in the head, dizziness, occasional headache, constant weakness, fatigue, disturbed sleep, these can all be symptoms of atherosclerosis, which develop precisely in these carotid arteries, which supply blood to the brain. Finally, chest pain is a clear sign, especially during physical activity. This indicates that atherosclerosis is developing in the vessels of the heart. Hence, these two non-invasive studies must be done by every person at the age at which I previously mentioned. And finally, if there are signs indicating the development of coronary heart disease, then please do a multi-spiral tomography of the arteries of the heart. This is also available today because coronary heart disease can occur in a painless form. Please do subscribe to our clinic's channel and press the like button if this video was helpful to you. When we talk about atherosclerosis, we must imagine what the arterial wall consists of, that is, what layers form it. Let's try to draw an artery section together. So, the inner lining is a monolayer of so-called endothelial cells. As already mentioned, the endothelium is a very important structure within the artery wall. It's in the form of a monolayer. The junctions between the cells are dense. Now I'm drawing you these cells, which are called endothelial cells, with tight junctions. The endothelium performs a lot of functions, like protection from the development of atherosclerosis. Next comes the middle layer, and depending on the type of artery, it can be elastic fibers, muscle elastic, and finally adventitia. Here I'm drawing the outer shell, adventitia. This is a cross-section of the vessel, and as we can see, the wall is quite thick. And now we extend it and get a vessel in the longitudinal direction. This is considered a normal artery. We consider the artery from the position of organs. It must also be supplied with blood. Here I'm drawing an arteriole, and the smallest capillaries extend from it, which we studied in our histology course. And this network is called vasa vasorum. They are the tiny vessels of the blood from the arteriole, the smallest capillaries, which are visible only under a microscope and supply the wall of the artery. If there are inflow pathways, in order to oxygenate the wall of the organ, then of course there must be outflow pathways, and we will now draw these outflow pathways. But this is where science begins, because we did not go through this in the histology course. Histology is the science of tissue. We studied this at university. We did not look at these tiny lymphatic capillaries under a microscope because it is the lymphatic system that provides drainage and detoxification. Well, let's just draw it in reverse order. Look, right from the wall, I draw the smallest capillaries. This is also a very branched network, so let's draw it. The network is called vasa lymphorum. And where does the lymph flow from the wall in this direction? It flows into the lymph nodes, because the lymph nodes ultimately drain all metabolic products, and also from the arterial walls. This is considered a normal functional artery with a normal functional lumen. It carries out its physiological function by blood supply to various organs. Well, now let's see what happens when the integrity of the endothelium is disrupted. And most often this happens during some kind of inflammatory processes, both infectious and non-infectious in origin. Look at how the endothelium is deformed. Next, we draw the middle membrane. We draw the outer membrane, and in the lumen of the artery, here we can find in front of you is cholesterol. Look what's happening. This cholesterol here rushes into these areas that we see, which suffer from undergoing inflammation, and it's the cholesterol that is captured subsequently. And I'll show you later a slide from a scientific presentation, not by some cells, but by immune defense. Let's mark these cells here in red. Here it's captured by this cholesterol, which in the future will form with very close participation of immune cells, nothing more than an atherosclerotic plaque, and calcium salts are always present in the blood lumen. And look, gradually, this plaque can calcify and harden. And of course, the entire lumen of the arteries is deformed and narrowed. This is how the so-called stenotic, narrowing the lumen of the artery, is formed, atherosclerosis. Let's see again here the blood supply system, the outflow system. Here are the lymph nodes. What is the task of the lymphatic system? The task of the lymphatic system is simple: to continue to perform its drainage and detoxification function. So the task of a lymphologist who understands all these processes is to remove through the lymphatic system this entire accumulated and even calcified composition of the atherosclerotic plaque. And let's now look in more detail at the scientific presentation at the process of formation of an atherosclerotic plaque. What is atherosclerosis? Let's look at the term, which consists of two Greek words, athero, mush, and sclerosis, hardens. So atherosclerosis is not the same as cholesterol. Atherosclerosis is a chronic inflammatory disease of the artery wall. Why? Because the artery wall itself has the highest metabolic activity, which is comparable to the metabolic activity of the liver. Therefore, the atherosclerotic plaque consists of a large complex of a wide variety of cells. Let's look at this atherosclerotic plaque. There are glycosaminoglycans, phospholipids, various types of fibers, collagen, elastic, and finally fatty acids, and many immune components. Where does it all begin? We see healthy endothelium that looks into the lumen of the artery, and we see damaged ones because of inflammatory endothelium. Most often, this occurs to the fact that this inner lining, which is called the vascular endothelium, encounters many infections throughout life. So the endothelium is damaged, and we see that cholesterol comes here and is captured. How? Innate immune cells called macrophages try to ingest the cholesterol, swallow it, destroy it, thereby gradually turning into a so-called foam cell. Here is the foam cell with trapped cholesterol inside it. These foam cells accumulate. The body sees this as a big threat, and the immune system attacks these foam cells. But the mechanisms of the so-called adaptive immunity are already activated. That is, it is the T cells that are activated. This leads to even greater inflammation, and the circle closes. As a result, the inflammatory process only gets worse. Reducing cholesterol with various lipid-lowering drugs does not lead to adequate success. Why? Because too much antigen has already accumulated in the artery wall to maintain this inflammation. But there's also good news. The lymphatic system, which is located precisely in the wall of the artery and performs its general function called drainage and detoxification, strives to remove the same accumulated cholesterol from the wall. That is, to carry out its drainage detoxification function. Let's take a look at this picture. We see a wide variety of subtle immunohistochemicals, which means that the artery wall contains elements of the lymphatic system, and this has been reliably established and confirmed. What do lymphatic capillaries and lymphatic vessels do in the walls of any organ? They precisely capture, drain, and eliminate within themselves, while connecting the lymph nodes, all large molecular substances, which, by the way, includes cholesterol. For example, we can see such very common pictures during thoracic operations that the lymph nodes of a person who lives in a city are not pink in color as they should look under normal conditions. They look gray. Why? Because the air we breathe, which contains dust particles, does not overload the lymph nodes of the tracheobronchial lymphatic system. It's not eliminated by the lymph nodes because everything is already overloaded. And in exactly the same way, the lymphatic system reacts to any biological objects, for example, cancer cells or bacteria, when they're captured by the lymphatic system and must be destroyed by all means, including just such a detoxification system as cytochromes P450. And what we saw is precisely what helps the lymphatic system remove cholesterol from the artery wall. how to reduce the risk of strokes and heart attacks. In almost every clinic, when a person sees a cardiologist or a general practitioner, they tell very little about these risk factors. Let us look at what these factors are and what negative effects they cause for the body and what needs to be done to reduce these risk factors. Firstly, of course, arterial hypertension. What does hypertension do? It disrupts the function of the most important organ of the inner lining of the artery, the endothelium, because from the inside the artery is extruded by the endothelium. What does the endothelium do? When it's intact or undamaged, the endothelium prevents mechanical damage to the arterial wall, adhesion and aggregation of platelets. Therefore, many factors that are produced by the endothelium and perform this function prevent the development of cell mass of the wall arteries directly. When damage occurs to the endothelium due to arterial hypertension, then the most important factor, nitric oxide, ceases to perform these functions in relation to the protection of the endothelium and in relation to the protection of the entire arterial wall. Therefore, you must always keep your hypertension numbers low by taking antihypertensive therapy without missing a day, because when you do so, the function of the endothelium can return to normal again. The second factor is very important. It's an increase in blood clotting. Now, this is extremely important in light of the recent consequences of the new coronavirus infection, which has disrupted the state of hemostasis, that is, the blood coagulation and anticoagulation systems in the direction of blood thickening. So you definitely need to know how these two systems work for you and take anticoagulants according to indications as prescribed by your doctor. The third important factor that I would like to focus on is diabetes. Everyone knows that high blood glucose is bad. What does high blood glucose affect? Firstly, it supports the inflammatory process of the artery wall, and we've already said that atherosclerosis is a chronic inflammation of the artery wall. So, glucose increases this inflammation and promotes the malignant progression of atherosclerosis, which means it leads to these extreme complications, such as a stroke or a heart attack. Moreover, high glucose levels precisely form a huge number of new vessels, the so-called neovasculogenesis in the artery walls, which are thin, often rupture, and can cause complications such as thrombosis. Another important factor is nutrition. Doctors always say that you can eat normally, but few people understand and know what normal really is, especially in the context of the development of atherosclerosis. There are foods that directly support inflammation, and it's not about cholesterol. So I recommend that you try to remove from your diet, starting today, if you know that you have atherosclerosis, foods that are called pro-inflammatory. That is, foods containing such substances that cause inflammation. And first of all, these are dairy products, and this has already been proven. Next are foods that are carbohydrate-rich and easily digestible, all sorts of sweets, buns, pies, ice cream. I would like you to pay attention to this factor, which is physical inactivity. That is, a sedentary lifestyle. It's very bad, but for some reason in modern culture, it's been looked at in this way. If you don't go to the swimming pool or if you don't go to the gym, then you are physically inactive. Start with the simplest things. You don't strive to become some kind of athlete and prove your strength at the gym. Just use less transportation services such as a taxi or your personal car and start walking for short periods of time, at least for 30 minutes. You must exercise your body. The founder of the Institute of Physical Culture, Peter Francevich Lesguft, said, "A body without movement is like stagnant water. It molds and rots, and all this really contributes to the development of atherosclerosis and accelerates its risks, strokes, and heart attacks." Now, we'll talk about the last factor related to atherosclerotic plaques. Usually you encounter the fact that neither the ultrasound specialist who examines you nor the therapist or cardiologist who looks at the ultrasound report recommends treating atherosclerotic plaques, but they believe that if these narrowings are hemodynamically insignificant due to atherosclerotic plaques, then everyone has them, and there's absolutely no need to treat them. I'm telling you, if you've been diagnosed with atherosclerotic plaques, those very tiny and weak spots in the artery that can rupture and cause blood clots, you definitely need to fight and treat them. Considering the fundamental knowledge in the field of lymphology that the lymphatic system provides drainage and detoxification of all pathological large molecules, including all products of impaired metabolism from any organ, including the artery wall, and also taking into account the immunobiological function as the most important function of the lymphatic system in the development of atherosclerosis, we propose a completely new paradigm for the way we look at, develop, and treat atherosclerosis. The problem of cholesterol is not the decisive problem in the development of atherosclerosis, and we have already proven this. Therefore, lipid-lowering drugs that reduce cholesterol do not specifically restore metabolism in the artery wall and do not provide a reduction in the inflammatory response. From here we consider the cholesterol problem as the secondary problem. The main problem is in the lymphatic system and its most powerful immunobiological reaction that enters the stage of clinical medicine. Therefore, we've developed, tested, and reported our own method many times, which we call the Lymphatec method. Lymphatec consists of 3 English letters, LAT, which stands for Lympha Access Technology. This is also the brand of our clinic, Lymphatec. So, what is the treatment for atherosclerosis? The core of the treatment of atherosclerosis in our clinic is the Lymphatec method, which is lymphotropic injections into the lymphatic region of the affected artery. In fact, the same we do in relation to other diseases when we administer drugs specifically to the lymphatic region, targeted, that is, to the area of the affected organ. In parallel with this, we ensure the normalization of blood pressure and the coagulation system, and we treat diabetes mellitus, as I already said, because this is one of the risk factors. We nourish our patients and provide them with the right recommendations regarding pro-inflammatory foods. We expand the circle of physical activity in such a person and all other factors that contribute specifically to the restoration of the body when we treat atherosclerosis. However, we do not prescribe lipid-lowering drugs, so drug therapy comes first as basic therapy. As for the rest of the treatment, we introduce metabolic agents, antihypoxins, antioxidants, electrolytes, and all this considering the state in which the person is in. That is, we select these medicinal mixtures very individually. What goals does our therapy pursue? The first is to restore the metabolism of the wall itself, which I already mentioned, that is very active in the artery wall. Then we reduce lipid oxidation, which improves drainage and detoxification, and the end result, this reduces inflammation. I want to mention that this method was patented in our clinic, and we directly treat atherosclerosis in our clinic. What does the course of treatment consist of? As a rule, it consists of 10 to 12 lymphotropic injections over 2 hours in comfortable conditions. Only doctors who have undergone special training in a licensed program called clinical lymphology from theory to practice can treat our patients. Let's look at the effects of treating atherosclerosis with our Lymphatec method. First, I would like to note the clinical effect, which appears rather quickly during the first course of treatment, and symptomatic patients, those who experience some obvious symptoms, will experience, during the first course, a regression directly from the reduction or disappearance of pain in the chest area and legs, and also ringing in the head and in the ears, and their sleep schedule returns to normal. Their general well-being decreases fatigue and increases tolerance to physical activity. Before and after treatment, we always do an ultrasound examination with Doppler for each patient. Let's look at a case that we reported at the Scientists' Conference of Lymphologists in Buenos Aires, Argentina in September 2019. I will show you a slide that's from a patient who, before treatment for the common carotid artery, had stenotic atherosclerosis. We see 40%. It must be said that his atherosclerotic plaque was dense, containing calcium salts. This case, which we reported, is characterized by the fact that the patient turned out to be very cooperative, probably because he was 45 years old and really wanted to feel well again. Since his physical activity was reduced and he felt quite bad, he took 4 courses of treatment. At the end of the 4th course, we see a decrease in stenotic atherosclerosis to 15%, despite the fact that the plaque was dense with the inclusion of calcium salts. We applied the drug directly to this damaged carotid artery, including its lymphatic region. Our doctors, as specialists, know very well the topographic anatomy, in particular the neck area. They know the cellular spaces and fascia. So objectively, in the first course, on average, we can achieve the following result: a 10% reduction of stenosing atherosclerosis in relative terms. For example, if a person has 50% stenosis, then after the first course of treatment, you can see a reduction to 45%. Of course, these are very good rates. But secondly, you must always understand what the plaque consists of. This man's plaque was dense with the inclusion of calcium salts, and therefore, first of all, our task was not so much to reduce the percentage of stenosing atherosclerosis, but to change the quality of this plaque itself in order to first wash out and drain the calcium salts by the lymphatic system. What does our method allow? Our method allows you to restore metabolism in the wall, as in this case. We change the composition of the plaque. These calcium salts are gone, which leads to slowing down the development of atherosclerosis, launching lymphatic drainage mechanisms, detoxification components of the lymphatic system, reducing or getting rid of the symptoms of atherosclerosis. For example, let us again return to the 45-year-old man. Not only did he have stenosing atherosclerosis in the area of the carotid arteries, but with the help of multi-spiral computer tomography, we also discovered that he had atherosclerosis, the so-called diagonal branches of the anterior ventricle artery, which we started the treatment for. On the 17th of September, the diameter was 73% and the area about 93%. After 4 courses of treatment, we see these results: that the diameter decreased to 29% and the area to 51%, and he became able to do physical activities. So we not only slowed down the processes of atherosclerosis and subjected it to regression, but we were able to change the quality of the structure of plaques, in particular the carotid arteries. Our patient will not only get rid of the symptoms of atherosclerosis, but they will restore their life back to normal. Finally, all this together leads to a sharp decrease in the most dangerous complications, heart attack and stroke. I emphasize that this young man was at risk of both a stroke and a heart attack. Moreover, a decrease in chronic hypoxia in his organs and tissues led to the fact that the patient's quality of life changed. His sleep normalized, his weakness went away, and his chronic fatigue also disappeared. In other words, we completely changed the quality of our patient's life. At the beginning of the video, I promised to answer the question, why do so few people know about the Lymphatec method or about our clinic? And every time during a video consultation, the most common question is not even about whether we can help or not, or help in a particular case, but the question is, why do so few people know about you? Why does no one know about the Lymphatec method? Why don't we see your ads on TV and so on? I would like to answer this question by saying this is not entirely true. Those who attend, participate in, or read texts from scientific conferences know about us. For example, in recent years, our scientific articles and abstracts at the World Lymphology Forum in Argentina and Novosibirsk were published. Secondly, let's imagine how everything new is moving into life. I think the answer is very simple. Our technologies are practically no different from any other medical technologies that don't benefit the pharmaceutical industry. Why? Because we use simple, accessible drugs from those groups, those classes that I spoke about, metabolics and antihypoxants and antioxidants. And on the other hand, everything new goes through 3 phases. The first phase, this can't happen because it is impossible. The second phase, we heard something about this. And the third and final phase, everyone knows about it already. Let's dig deeper. The first question is a question of knowledge. Currently, medical students are allocated no more than 1, maximum 2 hours to study lymphology. And knowledge in clinical terms is limited only to the metastasis of cancer through the lymphatic system. This is a whole fundamental science, and at one time we devoted time to studying this discipline, particularly first and second year students, interns, and residents, and also doctors of the Faculty of Advanced Medical Studies. These days, everything is different. Programs are shortened and impersonal in terms of lymphology. Unfortunately, the data of the lymphatic system should be known to doctors from the first year, but as you can see, this does not happen. Now, if I take a monograph from 1982, here it is in front of you. In this monograph dedicated to the morphogenesis of atherosclerosis, it is written in black and white that in the adventitia, that is, the outer lining of the artery, there are elements of the lymphatic system which perform lymphatic drainage. And when this system does not perform this lymphatic drainage, then atherosclerosis occurs. Look how thick the book is, and everything is described in detail. In modern literature, especially in numerous foreign publications even more so, these data on the lymphatic system in the arterial wall are presented at a very fine immunohistochemical level. Thus, since there's no knowledge about the lymphatic system among the medical masses today, there are not even prerequisites for the emergence of an understanding of the relationship between the lymphatic system and atherosclerosis. There's also a very important question, perhaps even the most important one. This is an ideological question, because for a modern doctor to reconsider all his views on the fundamental condition, what happens in atherosclerosis, he needs to have courage. He really just needs to have boldness, because for 26 years, old doctors have had ingrained in their understanding that cholesterol is to blame for everything, and that it is imperative to prescribe those drugs that reduce this cholesterol. Since 1996, a very aggressive introduction of statins into practical health care began, and the first statin was atorvastatin, which binds low-density lipoproteins. Therefore, a mandatory condition was introduced into the practice and life of every doctor that in case of high cholesterol, even total cholesterol, and God forbid, some fraction of triglycerides and so on, it's necessary to prescribe statins. It is cholesterol that is blamed for the formation of atherosclerosis because it is considered as a building material of the atherosclerotic plaque, when we have seen that this is not at all the case. Therefore, the pharmaceutical industry offered an ideal option that suits everyone. There's an elevated cholesterol level. Then there's a magical pill that solves the problem. And supposedly we answered the patient's request by simply lowering cholesterol. But at the same time, atherosclerosis develops. This is what all doctors do in clinics, both therapists and cardiologists. And otherwise, if they act differently, the insurance company will simply impose penalties on them and disallow coverage. So, there's an imaginary appearance that they're treating atherosclerosis by simply lowering the level of cholesterol in the blood. Finally, I would like to talk about the organizational issue. Today, in order to introduce something new into practice, it must be approved by the relevant committee of the Federal Ministry of Health because the research plan must go through the third phase, randomized clinical trials. But imagine who the competent committee in the Federal Ministry of Health is peopled by. The same specialists who've been introducing lipid-lowering therapy into practical healthcare for the last 26 years. Hence, unfortunately, for something new to become widely known to everyone and accepted by everyone, it can only develop in this narrow way, and it's the only way. So, let's summarize. Why is the Lymphatec method used today only in our clinic? Firstly, this is not taught to students in medical schools, namely lymphology. Our method is injection, and it requires knowledge of the topographic anatomy of the different areas where the medicinal mixture is injected, and a deeper knowledge of the lymphatic regions of each accessible vessel. Secondly, for 26 years, they taught a very simple thing. Take a prescription pill and everything will be okay. And finally, today in our country, there's no legislation that allows our clinic to conduct clinical trials. How to visit us for treatment of atherosclerosis. I invite you all, dear viewers, to treatment of atherosclerosis in the city Perm in Russia. Sign up for our online consultation, where our doctor will analyze your entire situation, answer all of your questions, and tell you how and when you can come for treatment.